What is the absorption rate constant, CAR, and why is it important? The absorption rate constant, CAR, describes how quickly a toxicant enters systemic circulation from the site of exposure. A high CAR means rapid absorption, leading to a faster onset of toxic effects. For example, nicotine has a high CAR when inhaled via cigarette smoke, causing rapid cardiovascular stimulation. Conversely, lead paint ingested by a dog has a slower CAR, leading to chronic, cumulative toxicity. In toxicology, knowing CAR helps anticipate the timing of clinical signs and plan treatment interventions like emesis or activated charcoal. What is Cmax and Tmax in toxicokinetics? Cmax is the peak concentration a toxicant reaches in the blood, while Tmax is the time taken to reach that peak. For example, after oral ingestion of ibuprofen in a dog, Cmax might occur at 1–2 hours, Tmax, depending on formulation. If a toxin has a high Cmax quickly, short Tmax, it indicates rapid systemic exposure requiring urgent action. These parameters help determine when to collect diagnostic blood samples and how fast antidotes need to act. How is the area under the concentration time curve, AUC, related to toxicity? The AUC represents the total systemic exposure to a toxicant over time. A larger AUC implies prolonged or intense exposure. For instance, two dogs ingesting different doses of xylitol may have the same Cmax but different AUCs, indicating one is exposed for longer and may develop delayed hypoglycemia or liver damage. AUC is critical for calculating IR availability and clearance, and for comparing different exposure routes, for example, oral versus dermal. What is the significance of volume of distribution, VD, in interpreting plasma levels? A large VD suggests a toxicant is extensively distributed into tissues, meaning plasma levels may be deceptively low despite a large body burden. For example, lipophilic drugs like diazepam or environmental toxins like DDT can hide in fat, making blood levels misleading. In contrast, polar compounds like aminoglycoside antibiotics stay in extracellular fluid, showing more accurate blood levels. Understanding VD helps guide sampling strategies and treatment decisions, especially when monitoring for residues or planning dialysis. What factors affect the rate of toxicant elimination? Elimination depends on renal and hepatic function, water solubility of the toxicant, species metabolism, and plasma protein binding. For instance, dogs eliminate aspirin faster than cats due to differences in glucuronidation. Hydrophilic toxins like ethylene glycol are excreted rapidly by the kidneys, while lipophilic ones like PCB accumulate. Any condition impairing kidney or liver function like dehydration or hepatic lipidosis can prolong elimination and worsen toxicity. What is meant by first-order kinetics in toxicant elimination? In first-order kinetics, the rate of elimination is proportional to the concentration of the toxicant. As concentration decreases, so does the elimination rate. Most veterinary drugs and toxins follow this pattern, for instance, penicillin in cows. This principle allows predictable dosing intervals and time to clearance calculations. However, at higher doses, enzymes or transporters may saturate, shifting elimination to zero-order kinetics where a constant amount is cleared, not a percentage, increasing overdose risks. What are zero-order kinetics and why are they clinically important? In zero-order kinetics, the toxicant is eliminated at a constant rate regardless of its concentration. This happens when metabolic pathways are saturated. Classic examples include ethanol and high-dose salicylates. In dogs poisoned with chalcolate, theobromine, if the dose is high enough, elimination can slow down, increasing the half-life and severity. This requires prolonged monitoring and sometimes repeated doses of activated charcoal or hemodialysis in severe cases. What are the implications of flip-flop kinetics in veterinary medicine? Flip-flop kinetics can lead to misleading conclusions. If the absorption is slower than elimination, plasma levels decline slowly not due to slow clearance, but because the toxicant is still being absorbed. For instance, dermally applied ivermectin in reptiles may show prolonged blood levels due to slow skin absorption, not slow metabolism. In such cases, traditional half-life calculations may overestimate the duration of toxicity, potentially delaying withdrawal decisions. What is a withdrawal period and how is it determined? Withdrawal period is the time after the last dose of a drug or toxicant during which animal products, milk, meat, eggs, are not considered safe for human consumption. It's calculated based on the time needed for residues to fall below established maximum residue limits, MRLs. For example, if oxytetracycline is injected into cattle, a 28-day withdrawal period ensures the drug clears from muscle tissue. Regulators use toxicokinetic models and tissue walks to establish these limits. Why is understanding species variation in metabolism crucial in veterinary toxicology? Different species metabolize toxicants differently due to variations in enzyme systems. Cats lack the curanyltransferase, making them more susceptible to acetaminophen and phenols. Birds excrete uric acid, not urea, altering how they handle nitrogenous toxins. Ruminants have a complex stomach microbiota that may inactivate or activate certain compounds. Understanding these differences is essential for selecting safe drugs, predicting toxicity, and setting species-specific withdrawal times.